I've treated hundreds of patients with ketamine now, and I've just seen that, not that exact experience, but similar mystical experiences that are just so life-changing. So.
Wow. So you've seen hundreds already. It seems like it's kind of new to me. It's kind of new. I don't think we heard about ketamine very much until the last year or so.
Well, so I've been using ketamine for the last 5 years or so. That's when I
Uh-huh.
started to learn it from Dr. Wolfson, and his partner, Julian Andrews. And since then, I came back after kind of learning about it and having my own experiences, which is actually really important to the process. And I think it's going to pose some challenges as we sort of teach psychedelic medicine in the future. It's another topic I'm really interested in. You have to have your own experiences, and you have to do your own work, with the medicine and otherwise. But I came back and I gave it to my practice, anybody who wanted to do it. And then people started coming to me, and then I started to do these trainings with Phil and Julaine. We started this thing called the Ketamine Training Center. And so we started to train people, like groups of 20 people. And so in my practice, and then I brought people into my practice and supervised them. So we really, I've done maybe 3 or 4 trainings, maybe more than that, with 20 people, and then my whole practice over the last 5 years. So really gotten the opportunity. I feel very blessed to see lots of cases.
Yeah, well, that's wonderful. One of the big issues, I think, there are a number of big issues surrounding this whole arena, but one is scalability.
Mm-hmm.
And for example, if you just look at PTSD, there's a huge PTSD problem out there. And so far, we don't have scalable solutions to meet the need is so much larger than the population of trained clinicians.
Mm-hmm.
And so that's one of the areas that I think this area is struggling with. What is the approval / legal situation with ketamine?
Well, so ketamine is legal. It's the only legal psychedelic medicine. I guess cannabis is also considered psychedelic at certain doses. So I should give that caveat, but it really is the only legal psychedelic medicine. And in April, Spravato, which is actually a related product, it's a ketamine, I can explain what it is, but it's a ketamine product that was approved by the FDA that was put out by Janssen. So before that, it was legal because it was a legal anesthetic, and now the Spravato product has FDA indication for treatment-resistant depression as well. And so it's legal, it's used off-label, and most of the treatments that we use in psychopharmacology are off-label anyway. So yeah, it's very exciting, and I think it gets missed a lot because it is legal, and because I think some people have the impression that ketamine is not as warm or as gentle as some of the other medications. I think there's some stigma out there about that, but that it's absolutely legal, and it's off-label, and it has a considerable body of research now to support it. Most of the research has been done using ketamine in the IV model, but really delivering it through the IV or delivering it in an intramuscular injection, which is a shot into into one of the muscles, or through a sublingual medication or oral medication. There's a fellow, Stephen Hyde, who wrote a book, Ketamine for Depression, and in New Zealand, he gave oral ketamine to patients with fabulous results. And so, yeah, it's really accessible. It's actually really cheap. The Spravato product isn't, although it may be covered by insurance, some insurances now, but ketamine is really cheap. And so what you're really paying for, at least when you come to a psychiatrist or a therapist to do it, you're paying for the person's time. If you go to an IV clinic, there's a lot more in terms of the setup, right? The IV and the clinic time and so forth. And a lot of those ketamine clinics have kind of popped up.
Yeah.
Because the ketamine, it has a biological effect. I mean, if you just give it to somebody, it helps depression. But if you don't do the therapy along with it, then it has a hard time sticking. And we think that may have something to do with, like the other psychedelics, ketamine also affects the default mode network. And so we think that we know that ketamine actually makes the brain more neuroplastic. And so whatever you're doing at the time of the ketamine, or, you know, within 48 to 72 hours, we don't know exactly, is going to really have the ability to stick a lot better. And so you literally can, like Michael Pollan, change your brain.